Hello friends, this is Dr. Puja Dewan, your gynecologist yet again with you. In this show discussing an important issue about thyroid problems in pregnancy. To some who are aware of this and to those who are unaware of this, let me quote to you numbers. Almost 9 or 10 out of 100 pregnant women have a problem of thyroid dysfunction during pregnancy. And amongst the hormonal endocrine disorders, thyroid problem is standing number 2 in position. So what is this thyroid gland? Well, it's a butterfly-shaped gland right there in front of your neck, in front of your air pipe, that is trachea. This releases two hormones, T3 and T4, what we call as thyroid hormones. And there is another test which is done in the thyroid function test, which is T3, T4 and TSH. So TSH. So let's understand, what does TSH indicate? When in the thyroid function test, TSH is high and T3, T4 are low, that means the hormones T3, T4 are less in production, so it is hypothyroidism. That is, the thyroid hormones are produced, less available, so there is thyroid hormone deficiency, which is hypothyroidism, and this is more common. When the TSH is decreased, that means T3, T4 are high, that means the T3, T4 thyroid hormones are being overproduced. That is, there is hyperthyroidism. Now, deficiency of thyroid hormones, that is hypothyroidism, is more common vis-a-vis hyperthyroidism. So we must understand what is the role of thyroid hormones per se. Well, they control a lot of parts of our body, especially our heart rate, our digestion, about our hair, quality of our skin, about our alertness, fatigue, tiredness, mood, irritability, laziness, slowness, etc. So if you have hypothyroidism, that is deficiency of thyroid hormone, your heart rate can be lesser, you can have constipation, you can have falling of hair, drier skin, slowness, laziness, fatigue, tiredness, etc. If you have hyperthyroidism, your heart rate is faster, you could be in heart failure, you could have a thyroid storm. You could have eye changes, particularly eyelid changes. Let's understand the different scenarios. Scenario 1, that you could be a thyroid patient even before you got pregnant. Scenario 2, you visit your doctor to plan a pregnancy and to get pregnancy pre-planning test done, and you are diagnosed to have a thyroid problem. Scenario 3, you never had your thyroid problem, never had your thyroid test, and for the first time, once you were pregnant and you visited the gynecologist, and amongst the tests prescribed, you have been diagnosed to have a thyroid problem. Usually it is hypothyroidism. So let's understand, TSH has a value of 0.5 to 5.5. It's acceptable to have TSH up to 5.5 when you're not pregnant. But if you're planning a pregnancy, struggling with infertility, or you're pregnant, the TSH value has to be less than 2.5 up till the first 3 months of pregnancy, that is the first trimester, next 3 months of pregnancy, second trimester up to 3, and the last 3 months of pregnancy, third trimester, again less than 2.5. What is the reason for that? The reason is that the baby which is in your womb for the first 3 months is yet developing the thyroid gland and takes another 2 months up till the 5th month in your womb to start producing the thyroid hormone of its own. So it is entirely dependent on the mother, on the pregnant lady, for its thyroid supply. So any deficiency is not welcome. Now let's understand what really happens to the baby or the mother in case you have hypothyroidism, that is thyroid deficiency. Well, the thyroid hormone is responsible for the development of the brain and the spine, that is the neurodevelopment. So cognition, thinking, IQ gets impacted. If you're hypothyroid, during your pregnancy, the baby could have low birth weight, intrauterine growth restriction, as in small in size and less nutrition going to it. The baby could deliver before time, preterm labor. There could be a miscarriage of the baby. In case you were taking infertility treatment, maybe you didn't conceive, maybe implantation failure happened, maybe the egg count reserve itself was low. And if conceived, there could again be a miscarriage. Now, what happens to the mother if the thyroid hormone is less? She could have anemia. She could also develop high blood pressure during pregnancy, which is called pregnancy-induced hypertension or preeclampsia. But in hyperthyroidism, there could be higher and faster heart rate of the mother, leading to heart failure or thyroid storm, and of course miscarriages as well. So, it is important that you consult your gynecologist and then, as per the instructions of your gynecologist, go ahead and get regular tests done. This is part 1 of the episode on thyroid problems in pregnancy. Next episode, part 2, we will be discussing how to manage it, investigations, frequency, dosage, can we get rid of it, the impact on the baby after birth, and whether there can be any lifestyle modification or dietary modifications which could impact. Thank you so much for your patient listening. I believe and hope that it would have been a session which has been fruitful for you. If you like this video, do put in a like, write down your comment in the section below, subscribe to this channel, share it with others. See you next time yet again. Stay safe. Take care. Thank you.